segment. I believe we have a break scheduled. Tanisha, would you mind talking more or listing? I know you mentioned some in your presentation about the different types of pharmacists that you can be, but just in case some people are only familiar with maybe one or two types, if you would expound on that more.
Sure. So pharmacists exist really across the healthcare continuum. Some of the things that are pretty exciting that you don't hear about all the time would be things like a nuclear pharmacist. And these are our pharmacists who work with those radioactives in our oncology world to make sure that we're getting, safe medicines and at appropriate doses for our patients. We also have a big push in the last, I would say, 20 years of pharmacists who do additional training. So this is like a 2-year residency program after school to become what we call clinical pharmacy specialists. And there's a wide gambit of things you can do with that training. So we have some pharmacists who will work specifically in pediatrics. We'll have pharmacists that specialize in geriatrics with our older patients. All across, different areas of specialty. We have pharmacists that work in cardiology and all those sorts of things. And they can actually see patients in a very similar way that you would see a provider seeing patients, and they'll have what's called collaborative practice agreements. And so they can prescribe medications while being the medication experts. And it really just is a different avenue and something that we didn't see maybe, 40 or more years ago in pharmacy. We're seeing more things come up like that. So I think those are some of the ones that are exciting and a different way to view the pharmacist outside of being in our neighborhood grocery stores and local pharmacies.
Thank you so much. And I do have actually one more question I would like to ask Travis. Can you tell me a time where you knew you had chosen the right field? So while you've been in school and been in clinicals or been able to interact with patients, what really solidified for you that physical therapy is exactly where you need to be?
That is a great question. And I think, because I'm actually on rotations right now, so I think I found why I want to be recently. So long story short, I had a patient that came in and they had basically dislocated a lot of things in their leg. And they had come to us just to kind of get back to function and things like that. And of course, they've had the surgery and things like that. And, it was just a lot of pain going on. And so they came in us and we got them to work, and, they're felt better, a lot better. And they said, this is the best I felt since I've gotten my surgery. So it's beautiful to see in physical therapy where you can just have somebody put your hands on them and, let them get back to whatever they love to do. And, I think it's beautiful when you get, either older patients in and they're like, I just want to get in and just be able to pick up my grandkids again. And, it's a beautiful thing to just see people's goals and just work with them towards their goals. So.
Awesome. Thank you so much for sharing that. Do we have any other questions from the participants?
May I ask one more?
Absolutely.
So I have heard that it's common to, when you go to college and then sometimes medical school as well, you think that you may want to be one type of doctor or surgeon or nurse, but then you find that you actually might not want to be that, or you want to be something different. So is there an average of how many times you may end up changing your mind or find a different interest which you want to pursue in the medical field? Or is there an expectation around that or anything?
I was going to direct this to Chelsea, since she mentioned that she changed from pursuing to be a dietitian to going to PA school. So I think she may be able to give us some great insight on that.
So originally I wanted to be a dietitian, but my junior year I found out I wanted to be a PA. So I ended up adding the minor, but I did have to take a few other prereqs. It just depends on what program you're interested in. But also why I chose PA is because even once I graduate, if I say I wanted to do pediatrics right now and then I started working in pediatrics and I didn't like it, I could always switch to something else. So that's like why a lot of people go into PA, because you can switch through like various areas of medicine and not be like stuck in one specialty. So I hope that answers your question.
So you're saying as long as you take all the proper prerequisite classes for whatever you want to switch to, you can technically switch around between so and so.
Yeah, in undergrad, you can.
In undergrad, okay, in undergrad. Okay,
Yes.
thank you.
No problem.
And I hope it's okay if I add a little bit to that.
Absolutely.
Yeah, so for example, in pharmacy school, the fourth year is spent doing clinical rotations, and you'll find this throughout many different healthcare professions, especially if you want to be a medical doctor. And those rotations really give you the exposure to the things that you think you want to do. And so that's a good chance and a good opportunity just to kind of learn more and see more what the day in the life is like. And then it's usually after that you can pick a specialty or kind of delve into some of those things that are a little bit more specific. So definitely, even once you get into PA school or into pharmacy school or into medical school, you'll get exposed to some of those general areas and you'll have the opportunity to decide what specialty you'd like to go into.
Thank you.
Thank you, Allie, for all your great questions. They've been really good. Do we have any other questions? If not, we're going to take a brief break and for about a 5-minute break. So feel free to go grab water, grab a snack, and we'll resume about 3:36. We'll try to grab everybody to come back so we can start the next part of our program.